Osteoporosis is parang lumalambot na yung buto. Not as strong, no? Kasi the microarchitecture and the structure of the bone itself medyo humihina na.
There's a common misconception that you don't need to worry about osteoporosis until your golden years. Actually, it's known as a silent disease. So as early as now, we need to take steps to prevent bone loss and strengthen weak bones. I'm Dr. Freddy Gomez. Join us as we learn more about osteoporosis, what to do if diagnosed with it, and practical and effective tips to keep your bones strong and healthy. Welcome to Med Talk Health Talk. Osteoporosis is a condition where your bones' strength and structure are affected. Now, to help us learn more about this, with us today is orthopedic surgeon from the University of Santo Tomas Hospital, Dr. J.J. Pua. Hello and welcome to the program, Doc J.J. Before we talk about osteoporosis, let's talk about our bones in general. Specifically, let's talk about bone mineral density and bone mass. Why is this so vital for our viewers to know?
Yung bone mineral density is actually the measurement of how much mineral your bones contain, and the more predominant mineral that is found in the bones will be calcium. It is a measurement of how many grams of calcium are present in the bones for every square centimeters. It's because the calcium component of our bones, they provide compressive strength. Ito yung nagpapalakas sa buto eh. When we have less of it, then bones become weak.
What exactly happens kapag ang isang tao ay na-diagnose with osteoporosis?
Technically speaking, osteoporosis is when you have abnormal or low bone mass already. No? So it is directly correlated to the amount of calcium present in the bones. And when it happens, the bone essentially loses its strength.
Lahat ba tayo at risk for developing osteoporosis as we get older? Is this inevitable? And does it only occur kapag tumatanda tayo?
One of the more common misconceptions that osteoporosis is only seen in the elderly or as we age, but there are a lot of types of osteoporosis. Meron tayong osteoporosis na the more common type, which is yung ating primary osteoporosis, no? And then the primary osteoporosis pwedeng postmenopausal osteoporosis, meaning we see this in women who become menopause, and we have yung senile osteoporosis naman, which is another form of primary osteoporosis, but this is seen in both men and women who are already aging. And the last one is yung secondary osteoporosis naman, that is can be due to other causes, no, like mga lifestyle problems, genetic conditions, no, like even yung mga vitamin D deficiency, low calcium intake, endocrine problems like diabetes. There are other conditions or diseases that can also give rise to osteoporosis aside from aging and menopause.
Let's talk about some of the red flag symptoms that may indicate na nagkakaroon na ng osteoporosis ang isang tao.
Well, actually, osteoporosis is not really so much detectable. Most of the patients who develop or who get diagnosed with osteoporosis just find out about it once they sustain, no, yung mga complications of osteoporosis already. Most notably fractures, no? So that is one of the hallmarks, no, of osteoporosis complications. But if you are going to talk about some red flags, probably one of the more common red flags that we see in osteoporosis is in the elderly, it's a sudden decrease in height. Kasi nga, of all the bones in the body, there are three common areas that are mostly affected with osteoporosis, no? Number one is the spine, number two is the hip, and number three yung sa wrist area natin. So for the spine, no, there can be undetected or even asymptomatic collapse of some of the bones in the spine, no, making us a little shorter. Or other than that is yung nagkakaroon ng parang hump, parang nagiging kuba yung likod. So these are some signs that we can see in the patient, no, pagka medyo we would like to suspect some beginning osteoporosis already.
One of the tests that are common in hospitals now is a bone density test. Talk to us about this test. Is it practical for someone who doesn't feel any symptoms to take this test?
The standard test, no, that we can use is called your bone mineral density test. Now, it uses dual X-ray absorptiometry. It's a non-invasive test. It's like just going to the x-ray to have something taken, no? It doesn't last long, okay? So basically what it does is it measures the actual density of your bone, no? From mostly two areas, no? Kasi ang pinaka-objective way of measuring the bone mineral density will be to get it from the hip and from the spine. It's not a mandatory test that everyone should undergo, no? Meron din tayo mga criteria when it is indicated for patients. And most of the time, it's indicated for men and women who are more than 65 years old. And it's also indicated for all postmenopausal women or men aged 50 and above who have risk factors already, like meron silang previous fracture that is associated with osteoporosis, so they have other risk factors like taking steroids, no, chronic steroid intake for a long time, no, and other risk factors like smoking and alcohol intake.
Bakit importante, Doc JJ, na maging aware ang mga viewers natin, especially when it comes to osteoporosis?
The problem with osteoporosis, it's only discovered, no, when a person sustains a fracture. We term these fractures actually as fragility fractures if it's associated, because it's a metabolic disorder. The bones weaken, and with any low energy trauma, no, like a simple fall, yung mga tipong napaupo lang, bigla na lang nababali yung buto. That's only the time that we discover osteoporosis. And if everyone is aware about screening for it, no, watching out for it, especially if they have the risk factors, then we can at least prevent and even address and cure osteoporosis to prevent these fractures.
That's a good point, and we will talk more about that later on the show. So stay with us here on Med Talk, Health Talk. It's never too late to take care and manage your bones before you get osteoporosis. Now, to help us learn more about this, let's welcome back to the show orthopedic surgeon Dr. JJ Pua from the UST Hospital. Ngayon, Dr. JJ, let's continue our conversation when it comes to osteoporosis. Magkaiba ba ang osteoporosis when it pertains to men versus women?
Basically, osteoporosis, no, is the same thing regardless of gender. But of course, it is more common, more prevalent in women compared to men. Ang pinaka-essential kasi dyan nga is yung postmenopausal osteoporosis, no? When women become menopause, bumababa or nawawala na yung estrogen levels nila. And estrogen is a very important hormone that builds bones, no? Kasi people think that the bones are just like the solid structure that's there throughout life, no? But it's actually a living thing, no? It undergoes a process of formation and absorption. So it gets replaced. So the problem with osteoporosis is that now, hindi na balance yung formation and absorption ng the old bones. And mas marami na ina-absorb na kaysa sa na nagpo-form na bago. So that's why it becomes very soft.
Now, madalas na tanong ito, is osteoporosis associated with scolio or scoliosis or even osteoarthritis?
Well, yes, sometimes, no, some people mix them up. Ang scoliosis is primarily a problem of the spine. It's a lateral curvature of the spine. So it's a three-dimensional problem, no? Naka either curve towards the right or in the left, and then may some rotational deformity ka pang kasama. While your osteoporosis, no, is basically because of the loss of bone mass. The spine segments, no, become soft and then they collapse, no, umiiksi siya. While yung osteoarthritis naman is another bone condition that is different from osteoporosis. It happens in the joints, no? Any joint in the body, sa tuhod, sa hips, no? Even in the fingers, even in the spine also. So everywhere when you have two bones meeting and moving, and then as we age, no, osteoarthritis is more of a degenerative condition because of wear and tear na ginagamit palagi. So the cartilage, no, in that bone erodes, parang nabubutas. And now that causes the pain.
Because we always like to advocate that prevention is better than cure, let's talk about a diet that is good for our bones. Milk is always good for our bones. Is this the only thing that we can do in order for our bones to be strong?
It is a very important, no, part of the overall management of osteoporosis, but it is not the sole treatment for osteoporosis. If you are especially diagnosed already with osteoporosis, then hindi na enough, no, yung pag-take natin lang ng milk or gatas. True, it is important because especially yung mga fortified milk, no, because it has the essential nutrients that the bone will need, like calcium, okay, and vitamin D. These are two important nutrients na kailangan for bone metabolism. But if it's already a diagnosed case of osteoporosis, then we will need other medications. No? Aside from the nutritional supplement coming from the milk itself, we will need yung mga anti-osteoporotic medications na talaga. Now, these are really to address the problem of bone density loss.
Speaking of anti-osteoporotic medications, for many years actually, osteoporosis was seen as a condition na once na nagkaroon ka nito, mahirap nang bumalik. Is that still the same thinking now?
Used to be a long time ago, but right now, there are a lot of medications, no, that have been invented, no, and manufactured already for the sole treatment of osteoporosis. So hindi na siya untreatable disease, no? There are already existing medications that we can give to patients that can address the problem of bone loss. Kasi these medications will address the cellular molecular level kung ano yung problema sa mga buto eh. So available na talaga siya. It's just we need people to be aware that it is available.
That's very good news, and of course the best information that they can get is by visiting their orthopedic surgeon when it comes to any problems that they may have, especially when it comes to their bones. Speaking of types of treatment, many people feel pag nakita nilang symptoms, loss of height, iba na yung curvature ng spine nila, they might seek treatment that can have adjustments, maybe papamassage para makorrect yung deformities. Is this okay to do?
Those mga non-pharmacologic, no, interventions, there's no harm in it, especially yung mga anything that will provide some comfort, no, from to soothe yung back pain, no, yung mga ganito na associated symptoms with some spine problems. But of course, any treatment that involves any adjustments or manipulation of the spine, then it will probably be prudent to go to someone who has a lot of experience in doing this.
Now, when it comes to exercise, some studies have shown that for bone strength, bone density, it's not enough to actually do some aerobic exercises, but weight resistance is actually helpful for bone strength.
Yes, no, that's correct, Freddy. What is essential, no, for exercise when it comes to osteoporosis is yung tinatawag natin na weight-bearing or resistance or strengthening exercises. No? Because our bones, as I said a while ago, no, are living things. They are very adaptable. The reason why we need weight-bearing, no, it's because we can put more stress on the bone. Now, the bone, if you stress it, it will respond. It's the same reason why, let's say, athletes or manual laborers, no, mas makakapal yung mga buto nila. It is because it is subjected to regular and repeated stress. So when we exercise, no, for osteoporosis, or when we recommend exercise for elderly individuals, sometimes it's not enough to do some light aerobics. No? Any weight-bearing exercise, meaning what? We are walking, jogging, no? Or just putting any weight on sa joints ng ating ng lower limbs natin, then those are enough. No? Especially for elderly, no, this would be around at least 2.5 hours of weight-bearing exercises for 1 week to offset or to at least help in osteoporosis.
Before we go, do you have any advice, any tips para sa mga viewers natin, especially when it comes to understanding osteoporosis better?
Well, for one, it is always prudent to screen. It's hard kasi pagka malalaman mo lang may osteoporosis ka pagka you already get these fragility fractures, no? Because it is not the osteoporosis actually that causes more problems. It is the complications that you get from osteoporosis, especially fractures. So, ang important thing is, to see your doctor, to get your bone mineral density screening, no, once you are indicated for it. No, again, for men and women over the age of 65, kailangan na yan, no, for screening na. For women who are already menopause, kailangan na rin. And for men, kahit let's say 50 years old, no, but they have some risk factors associated with osteoporosis, then they need to be screened. No? So screening is the most important, no, because this is a very treatable and preventable disease if we know it. And once we are diagnosed with it, then we need to remember that exercise, proper nutrition, no? And if osteoporosis na talaga, to start with the anti-osteoporotic medications.
Okay, very nice information. Thank you once again, Dr. JJ Pua, orthopedic surgeon, for joining us here on MedTalk
Thank you
Health
for
Talk.
having me.
Earlier, we were talking about osteoporosis, and I'm sure a lot of our viewers have their own questions about their medical concerns. Now, let's take this opportunity to answer those questions.
Ang tanong ko lang po, paano po malalaman na ang simpleng sipon ay isang symptoms ng COVID-19 at hindi sa pababago-bagong weather?
That is a very common question. So, symptoms of COVID-19 are very general and non-specific. So, pwede sila mag-overlap. So, the best thing to do, treat it as though you have COVID-19 unless proven otherwise. You should follow the basic protocols, especially when it comes to isolation. It is also not a bad idea to take a test for COVID-19 just to make sure. But what you should know is that if there are symptoms such as tightness of the chest, difficulty breathing, you have to seek medical attention right away.
Doc, hindi raw advisable gumamit ng cotton buds. Anong dapat gamitin panlinis ng tenga?
Okay, madalas na tanong din yan. So, ang paggamit ng cotton buds is not really for cleaning the inside of the ear. That external part, which is composed of the lobe you have here and the folds that you see outside, you can clean that with cotton buds, but never insert anything inside your ear. Your ears contain small hairs that naturally push earwax outside of your ear in order to clean its own. So it has its own cleaning mechanism internally. Speaking of earwax, don't think of earwax as something that is bad, because earwax to some degree is there in order to protect you from other bacteria or things like debris. Visit your ear, nose, and throat specialist. Have your ear checked. If there's any debris or if there's any excess earwax, have it removed. And then from there, don't touch the inside of your ear at all.
May paraan pa bang maiwasan ng katulad ko na medyo tumatanda na para hindi magkaroon ng dementia?
Dementia is not one specific illness, but it is a general term for a condition that affects someone's memory, their ability to speak, their ability to recall, which can affect their daily functions in life. Now, Alzheimer's disease is the most common type of dementia. Now, when it comes to dementia, it is usually associated with advancement of age, so people who are older, but it has to be noted that dementia is not a normal part of aging. And there is no one measure that can prevent dementia from happening. So the best thing here is to talk to a neurologist, talk to your doctor, especially when it comes to things like dementia or even Alzheimer's disease.
Doc, enough na po ba yung 10 minutes na exercise at home kung hindi ka makapag-gym ng isang oras every day?
For general overall health, 10 minutes of exercise a day at a moderate pace, that is good. What is key here is not how long you do it, but how consistent you are in your physical activity. But if you're talking about weight loss, what you have to understand here is that you have to be at a caloric deficit, meaning you have to be expending more calories than you are taking in. So a key factor here, of course, is proper nutrition. You don't have to really exert yourself with each workout to get the maximum benefit. A good guide here, if you can still carry on a sentence or you can still talk while doing that physical activity, you are okay. Kapag hinihingal na kayo, hindi na kayo makasalita dun sa physical activity ninyo, you may going past that good area of your heart where fat burning occurs or thermogenesis occurs at its best. To go back to it, the key factor here is not how long you exercise, not how intense you exercise, but how consistent your exercise is.
Doc, may allergy po ako. Ano ba pong pwedeng gawin na hindi na po ako inom ng gamot?
So when it comes to allergies, we have to make it clear first the difference between an allergy and an irritant. When you are allergic to something, what it does is it triggers an immune response and mainly involves histamine here. And so you have a lot of symptoms that may prompt it to be an allergy. You might have rashes, you might have swelling, you might have redness. That's different from what's called an irritant. So when it comes to true allergic reactions, it is very dangerous not to address this medically because it can become more serious and even reach a state where it's called anaphylaxis, where the swelling that is involved in this allergic reaction might have you cause difficulty in breathing. So you have to go to your allergologist, go to your doctor, and talk about what type of symptoms you feel when you're exposed to certain things, because it might not be an allergy, it might be an irritant, or vice versa. When you do know what causes your allergic reaction, you have to be prepared. And the best thing to do this is medication prescribed by your doctor.
Doc, meron po akong kakilala, mahina na po ang kanyang pandinig. May pag-asa pa po siyang makarinig ng maayos katulad ng dati?
Okay, so when it comes to hearing, maraming mga rason kung bakit humihina ang pandinig. Pwedeng humina ang pandinig natin dahil sa pagtanda natin. The first thing we have to note here is to have a hearing test. It's called a pure tone audiometry. So based on what your ENT doctor finds, they may require certain medications to sort of alleviate this, but sometimes a hearing aid may be the option here. Now, a hearing aid is not supposed to bring your hearing back to when it was before. It's something to slow down the hearing loss process. So we have to understand the limitations of this. So whenever we have problems with hearing loss, it's best to go to your ear, nose, and throat doctor to maybe have a pure tone audiometry test done. We hope you learned a lot from those questions. Now, always remember to prioritize your health. Always eat right, exercise to keep your health and your immune system in tip-top shape. I'm Dr. Freddy Gomez, and thank you for joining us here on Med Talk, Health Talk.